My name is Timothy Tan, and I will be talking about a recent paper of ours published in JBJS entitled Determining Diagnostic Thresholds for Acute Periprosthetic Joint Infection. What led us to do this research was that we were finding that many patients with an acute PJI at our institution frequently had values less than what was recommended for the current cutoffs from the ICM in prior studies. Many patients had CRPs less than 100 and cell counts less than 10,000. 2 years ago, we performed a study where we reevaluated the current cutoffs and found that CRP and cell counts only had sensitivities between 50 to 60% when using the previously established ICM cutoffs. Thus, in this study, we aimed to determine the optimal thresholds for acute periprosthetic joint infection for both serum and synovial markers. One of the unanticipated problems of this study was that we found that it was very hard to get an adequate control group. In order to do this, we required that all patients had serum and synovial markers, so the aseptic group had to have aspirations. In order to do this, we had to involve 4 other institutions. The main finding of our study was that current cutoffs are probably too high. The cutoffs in our studies were substantially lower, and we also found that the acuity of the infection really did determine what cutoff should be used. For example, if you look at cell count, if you look at a 90-day cutoff, a cell count of 6,000 was needed as a threshold, versus at 45 days, it was 8,000, and at 30 days, a cutoff of 10,000 was used. Furthermore, we found no real difference between cutoffs for hip and knees. We believe our study is of value as this gives providers some leeway in order for defining what is an acute PJI, because there is this huge controversy regarding whether an acute PJI is 30 days or 45 days. So we let the practitioners determine what they want to define an acute PJI with, and we give them a threshold accordingly. One of the important questions is, why are our values different than other studies? And we believe this is because of the control group. We had control groups that weren't just periprosthetic fractures and trauma, which the prior studies had. And we think that this is largely the reason our values are lower, because we all know that trauma can increase serum and synovial markers. Thank you for your time.